Introducing the Amplify LTC Pharmacy Podcast, your ultimate resource for long-term care pharmacy. Tune in to the inaugural episode as we dive into the revolutionary impact of at-home pharmacy models in long-term care. Watch episode 1 now.
We are on a mission.
A mission to save and revitalize independent pharmacy.
On the Catalyst Pharmacy Podcast,
You will get actionable business advice
hear stories from industry leaders,
and share a laugh with us.
fuel your passion for pharmacy.
One conversation at a time.
Good morning, Julie.
Good morning.
Hello.
Hello.
Hi.
Welcome.
I have probably met you. I'm good with faces, but bad with names. So I'm Jeff Key. I'm the president of Pioneer. I was employee 1, and this is Marsha Bivins.
Marsha Bivins. Nice to meet you.
Hi. Nice to meet you.
So this is an exciting week just all around. So I'm going to go ahead and put this out there. We just filmed our 100th podcast episode. So you are 101.
You're the beginning
Okay.
of a next
Beginning
100,
of
a
the
next
next
century.
100.
The Centaurian. I don't know.
Yep.
Something exciting.
So, and then
Yeah.
plus also,
The next wave. I like that.
there we
you
go.
go.
Teaser.
This is the next wave is 101. So, and plus also fun. It's like, hey, we're at the end of summer, school is starting, and you've got kids that started back to school this week or soon or have already started.
My high school junior started back this week. He started on Monday. I've got a college kid he starts a little later. So his first
Okay.
day isn't until the 28th, I think, of August.
Where does he go to school?
Colorado College in Colorado Springs.
College. Okay.
All right.
Yeah.
Oh, that's Colorado
So-
Springs is nice.
Yeah.
My son started Wednesday, first day of high school.
Oh,
And then my daughter,
Bum, bum,
first
bum.
first year of college, she will start in Labor Day weekend. So that's when we're moving her
Oh,
to
wow.
Savannah, Georgia. But yeah, so I've got 2 freshmen.
yeah.
my-
I have 2 juniors.
Yeah, so
got a
lined up. So
freshman
next year
in
you'll have
high
2
and-
seniors. What a
Oh, wow.
crazy. So what all is your son
Yeah.
into in high school?
So he was in the marching band, but he has been involved in School of Rock.
Okay.
Playing drums and keyboard, and so he decided to focus on that. And then he plays tennis as well, but like any teenage boy, he loves to play video games. So,
Right.
Yep.
yeah,
Yeah.
those are his
We know how that
go-tos.
is.
And
Yeah.
Drums and keyboard. That kind of Phil Collins-y, isn't it?
that is a little Phil Collins, yeah. And then your college student, what are they going to college for? What's the plan?
That's a good question. No, he,
That's a good question.
Yeah, no.
when I know, you'll know.
Yes. Well, he went in thinking he might be pre-med, and after about a semester, now right now he's saying he wants to do environmental economics. So
Okay.
we've kind of done a
Interesting.
180.
Yeah, that is kind
Yeah,
of
that's-
different.
360. Yeah. So he's got a lot of interest, and he's really smart, and so he'll, I'm sure, do great at whatever he decides on. But
Right.
yeah, definitely. And we expect that. You know, I didn't go into college thinking I was going to be a pharmacist. So
Yeah.
Yeah.
So what part of the country are you in, Julie?
I'm in Arkansas,
Arkansas. Very nice.
Okay.
What
Yeah.
part of Arkansas?
the northwest corner. I'm in Walmart land. So
Oh.
I'm at Fayetteville. but,
Nice.
Bentonville
Okay.
is just
Yep.
north of where I live. So,
So you couldn't talk your son into going to University of Arkansas?
absolutely not. He wanted to
Get away.
get out of
Yeah. Real
Arkansas.
mountains, right?
Yes.
Well,
Yeah,
I mean,
so-
that's,
so my
that's
son
the
went
same
to-
with Kyle. Y'all lived in Louisiana, and
Yeah.
he wanted to go to Arkansas.
Yeah, my son went to University of Arkansas.
Yeah.
Oh, okay.
And
yeah.
he's currently he lives in Arkansas, but he's working on moving to Kansas right now.
Right. Yeah. He lives
Okay.
he lives in Fort Smith where he did an internship.
Yep.
Okay. That's where I grew up.
But last weekend, my wife went to visit him to kind of say goodbye to Fayetteville and stuff because he's moving in a couple of weeks to Kansas City. So they went and
Okay.
visited their little favorite restaurants and stuff around there. And
A
Nice.
farewell tour.
And kind of a farewell tour.
Food tour.
Enjoyed that.
That's
Yeah.
interesting.
Kyle was
So-
in the band there, and
So okay.
Okay.
If you had a farewell tour food, what would be your 3 restaurants?
what about
What
you?
about you?
In
What is-
Fayetteville?
In Fayetteville,
Yeah,
what,
Fayetteville.
what's your top 3 places to
Oh,
eat in Fayetteville?
um,
If you're gonna move away from Fayetteville, anything you want to get
what
before you
are the
leave?
things that you're going? I got to eat here one more
So-
time before I leave because it may be my last.
Well, everybody loves Hugo's, which is like the
Okay.
hamburger place.
That's the one down in the
basement.
basement.
Yes.
They're amazing. That's the place I would
Yes.
say in Fayetteville. Their French fries
Okay.
are great.
Yeah,
Yeah.
they have great French fries, great burgers. So that's good. We love Bordino's too, which is also
That's Italian.
It's
Okay.
downtown, yeah,
Yep.
and it's great.
So now you need either a
ooh.
Mexican or a steakhouse.
Okay,
You've
so-
covered burgers, you've covered Italian, so now you've got to
let's
fill it with.
see. Well, I mean, there's so many good Mexican restaurants. Rolando's. Wait, it's not
Rolando's.
Okay.
Mexican. It's actually Ecuadorian, I think.
Interesting.
But,
Okay.
We have a place like that. Isn't that kind of what Gloria's is here? Is kind of Ecuadorian.
Is that what
Really
Gloria?
good.
I thought it was like Latin.
Oh yeah, maybe.
Yeah,
Latin.
I didn't think it was. I thought it was Latin. Okay.
So
Well,
Yeah.
flip the pharmacy of the year in 2022.
congratulations.
Congratulations.
Thank you.
That's incredible. But shout out for Arkansas and Northwest Arkansas. Pretty
Mhm.
area too. Are you a mountain biker?
Yeah, I'm not a mountain biker. We do have some of the best bike trails around here.
Yeah, it's really nice.
So I do like to ride when I get a chance, or even just jog on the trails if I can.
Yeah, it's so pretty. What's the weather like that right now today?
Hot. Well, it's been the last 2 days have been weirdly nice, like almost fall like
Yeah, that was the
in the
same for
morning.
us.
But August is usually pretty miserable.
All
Yeah.
right, so what's today? What's the high today there?
Good question. I think it's like 91, 92, something
Okay.
like
I will
that.
take
Next week
that.
it's going to be all in the mid 90s. So.
Yeah. So it's a high today here is 108.
Yeah.
So and
Oh,
we're like
gosh.
5 hours away. I'm like
And where
Let's-
you're in?
we're in Dallas.
in Dallas. Yeah.
Yeah.
In Dallas.
Yeah.
Oh yeah. Well, we fly through Dallas a lot. Anytime we're going on a trip or
Yep.
something, it seems like we're always going to Dallas. So
Yep.
right,
it's
so-
always hot.
So tell us
how did you get started? So let's go through. You went to college. You said you didn't start off going for pharmacy.
Right.
So what made you switch to pharmacy?
Well, no, first, what did she start off as? What were you going to
Ooh,
be before
yeah.
pharmacy?
What was
Well,
What was this?
you know,
What was
I-
this possible lifetime that faded away?
Well, yeah, really. I didn't know for sure, but I kind of thought I wanted to be a pediatrician.
Well,
Okay.
And I took cell biology like at 7:30 in the morning first.
Oh my goodness.
My school actually had trimesters, so we had it was first trimester, 7:30 a.m. cell
It's
biology.
appropriate when you're dealing with babies.
And yeah, and so I after that I was like, I don't know if med school is for me. I don't know. It was rough. I mean, you wouldn't expect your first
Right.
class in college, but and then the summer after my freshman year I worked in a pharmacy. A longtime family friend. Really enjoyed it. I loved chemistry. And so it just kind of the pieces sort of fit together. And at that point, I just decided I thought that was what I wanted to do.
That's sick. I'm not saying
Yeah.
about the chemistry thing.
I think I think I'd be with you because the first time they tell me that I've got to give a baby a vaccine, I'm gonna cry with that baby. I'm like, I'm
Yeah,
sorry.
My daughter said,
Right.
"What does Daddy do?" And I'm going to do that. So I was a programmer. My daughter's a programmer. My son was like,
What's your least
"What did you
favorite topic?
really challenge about?" I was like, "I really didn't like chemistry." He's like, "Chemical engineer. That's what I'm going to be."
Oh, yeah. That sounds like my younger son. Yeah. Like whatever. Yeah.
Well,
Yeah.
yeah. Let me take
Go
up
and
my
get
own
the
path.
Yeah.
So
for
does
sure.
he have his path already kind of laid out, or what he's thinking about when he graduates high school?
He loves anything space related.
Oh.
So, but he does not want to go into space. Interestingly, he's not
Doesn't want
be
to
an
physically go
astronaut.
there. Yeah, that
No,
that
he
generation
just
is
wants
pretty
to
low on the
study about
risk,
it.
pretty risk averse. So
Yes,
Mhm.
yes, for sure. So we'll see. He may be some kind of engineer. He loves seeing how things work, and he's always been that way. So yeah,
Huh.
who knows?
Yeah, that's my
Fun.
son. He loves to tinker and see how things go together. And it's like, what are you doing? And how are you doing it? And can you touch that? And if you touch that, what's going to happen? And he wants to go into some type of engineering, civil. He wants to be a civil engineer.
My first biology class, speaking of biology, was a breaker as well. It was one of those deals, the big stadium and hundreds of students in there, and the teacher passed out a deal showing the grades from the previous semester and how like 2/3 of the class failed and all this stuff. Really, you're like trying to scare us. And we're I'm like, did you figure out what you did wrong?
Yeah, that's what I'd be asking them. Like, do you not know how to teach? I mean, obviously, if they didn't grasp what you were putting down, I mean,
it's all right. I got the second highest grade in the class. There was a lady who that was her only class, and she beat me. So I rose the challenge. But it was weird. It was like, oh, this is really bad. And it was a weed class, which I imagine that probably was what you had experienced, was a class trying to weed people out.
Yeah.
Okay, so
dreaming about med school.
We went from possibly being a pediatrician to now we decided pharmacy. What was the move?
I think that experience I had working in it was a small town community independent pharmacy. They did compounding, which I really enjoyed.
Yes, cool.
It was just I loved. I think I knew I wanted to do something in healthcare, and that the medications and chemistry and all of that just. It just sort of fit together, I felt like, for me and what I enjoyed.
Can you imagine how fun it was being a pharmacist a long time ago when you were compounding meds and you would try something and they'd come back and they'd say, well, I did this, and you'd try a little bit more of this and try a little less of that.
Right. Well, C.O. Bigelow has the formula.
Yeah, he's got the book.
Yeah, C.O. Bigelow's got the
and then something to work
books.
and you really
And then they started naming their compounded mouthwash and stuff after that person when they're like, this is perfect. I loved this formula. And it's like, okay, we made it specifically like that for Dr. John, and then it's like Dr. John's cinnamon mouthwash or something like that.
But that just kind of tweaking and it's just kind of
the tweaking,
interesting.
the fun, and just getting it just perfect to a point that customers prefer that product. Yeah, it's super cool.
Yeah, and my first job out of pharmacy school was I worked at a pharmacy that did compounding, and which was great. I mean, we did hormone replacement, we did stuff for animals. So that was interesting. Sometimes the compounding lab smelled like beef or chicken or tuna fish, depending on if it was a cat or a dog or whatever.
That'd be the week I skipped.
That's a whole new, that's a whole new deal. Just people cooking fish in the microwave.
Jeff, you get to do that compound. I'm gonna just do med-sync or call patients today.
Yeah, Marsha's particular about her smells.
Yeah,
it happened when I was pregnant with Cohen. Like people, because my desk was like on the other side of the kitchen, and so when people would start to microwave their lunches, I'm like, I've got to get out of here now. Yeah, and just I don't know, but pregnancy does that. So
yeah, it does. Like certain things, and those smells stick with you. It's like I know, like SpaghettiOs. I remember the smell of SpaghettiOs. Made me sick when I was
wow.
And
I thought when you're pregnant, you want to eat everything. I thought everything smells good.
Actually there was an interesting study that I read that you can tell if you're pregnant with a boy versus a girl, because with a boy you want to eat more things, and with a girl your diet really doesn't change that much. But with a boy it's like you want to eat everything.
Yeah, I wonder if that's a difference in the hormones that are going on or something.
Probably, I don't know.
All right, so the first pharmacy independent, and where was that? Was that near where you are today?
It was in Tulsa, Oklahoma.
Oh, nice.
My husband is a dermatologist, and so we had to move around a little bit he did his internship there, and then we lived in Shreveport for a year, and then New Orleans for 2 years.
Yeah. So, what year were you in Shreveport?
We were in Shreveport from 2002 into 2003.
Yeah.
Okay.
I was there.
That's actually where my older son was born.
Oh, wow.
So, yeah.
That's where my youngest son was born.
Oh, wow. Okay. All
right. So Shreveport, I got stuck on Shreveport. You're like, okay, hometown gal.
That's where Pioneer started, was Shreveport, Louisiana.
All right. So you moved from Shreveport to
New Orleans.
Oh, wow. Okay. And how long were you in New Orleans?
So we were there for 2 years till 2005. We moved in June of 2005, 2 months before Hurricane Katrina.
I was just thinking, that's close to Katrina.
Did you get some good food in New Orleans?
Oh yeah,
Yeah.
for sure. Yeah, there's lots of good restaurants there. Yeah.
Mm-hmm.
It's one of my sad life
And then,
deal that
yeah, we're going to leave it alone. We're
Okay.
going to leave it alone.
going to be positive vibes.
Positive vibes.
A lot of my
good
favorite
memories.
restaurants are closed in New Orleans
Yes.
because
The
of COVID.
pandemic
You know, just a
and-
series of
Right.
hurricanes and COVID. And I think some guys, they just decided, hey, this is it's not meant to be.
Lemony
But-
Snicket.
All right. So went from New Orleans then
To Arkansas or?
Yes, then to
Okay.
Fayetteville. So I started working at the pharmacy I'm at now, actually the day Hurricane Katrina hit. So it was August 29th. So it was an easy day for me to remember. So I've been there now almost 18 years.
Wow. Congratulations.
Yeah. Yeah. I started here and never looked back. It's been I've loved it. And it's been interesting seeing the changes in pharmacy, as through the years that I've been here.
Yep. So how did you tell us about when and flip the pharmacy? So how
Yeah.
were you, what were you flipping?
Yeah. Well, so, it kind of, Arkansas got involved in the grant kind of right in the midst of the COVID vaccination effort. And so we were very heavily involved in that. We probably did, in 2021 and 2022, gosh, I don't know. I mean, in the tens of thousands, maybe approaching 100,000 vaccines, COVID vaccines. And so that was a big part of it.
Wow.
Vaccinations were one of the focuses of Flip the Pharmacy. So in addition to that, we take patient blood pressures. We did some diabetes. We were involved in the diabetes study, and so measured some A1Cs. And adherence to diabetes medications and whatnot. So and then we utilized the Pioneer e-care plan platform to sort of document a lot of that.
Yep. Yeah, and those of you in the rest of the country think in Arkansas, like, hey, do they have cities in Arkansas? Kind of, but
Yes.
but independent pharmacy in Arkansas is happening. It's very progressive. Get a lot of grants.
Yes.
They do a lot of really great stuff.
Right. Yeah, we've been pretty involved too in a lot of the legislature that's happened. It was our attorney general that got some of the PBM legislation to the Supreme Court, and
it's just incredible.
Pharmacy and our pharmacy association is just great. They're great at really being involved in the politics and in the the lawmaking and whatnot to help us further pharmacy here.
So we won the Flip the Pharmacy Award, right?
Yep.
Now that can't be our biggest hurrah, right? That can't be
definitely not.
That can't be the top of the mountain. So what are we working on
Right.
now? What kind of things are
What's
we trying
the
to
next
do?
mountain?
Yes. So we, I got accredited to do diabetes self-management education back in November of last year, I believe. And then so we're trying to get that program going. We've already graduated our first class, and so
Wow.
and I've started on my second round, and so we just got small classes trying to get our data to the doctors to kind of prove ourselves, and then hopefully it'll take off and go from there. We also one of the great things about pharmacy in Arkansas is one of the biggest payers, Arkansas Blue Cross Blue Shield, has really been pharmacy forward and has decided to pay pharmacists to do smoking cessation counseling.
Okay.
To pay pharmacists to do test and treat with COVID, flu, strep.
All right. So
And then-
so for flu, you can test for the flu and prescribe the Tamiflu, or do you have?
Prescribe the Tamiflu.
Oh, wow.
Or
That's
Zofluza.
amazing.
Yeah. We have protocols for all of those, and strep as well. Prescribe amoxicillin, or if somebody's amoxicillin or penicillin allergic,
Right.
then there's kind of a step-by-step
So how do you
protocol.
and so you can do that state-wise. Blue Cross is paying you for that, right?
Correct.
But you could do that cash-wise as well.
Yep.
Absolutely.
So if somebody had a high deductible or something like that, and they think they have strep or the flu, they can just come by the pharmacy, get a test. Cash-wise, what does that run?
That's a good question. We are not doing test and treat just because we're focusing on some other things, and we're
Okay.
actually located right next to a clinic that has walk-in capabilities, and so we want to maintain a good relationship with them.
Right.
Okay.
We've tried to not step on their toes, and so we've kind of stayed out of that arena for now. We'll see what happens in the future, but for now, that's not our focus. So I apologize. I can't tell you what the cash amount would be.
Yeah,
but,
and so that's interesting. You see that a lot with independent pharmacy. They have these close relationships with nearby physician clinics, and they're hesitant to do some of these things, that are moving pharmacy forward. As far as
yes, but the one thing about Arkansas is there are a lot of rural areas where there are not doctors' offices close by. But there may be a hometown pharmacy. And so, if you live in rural Arkansas and you think your child has strep throat and you don't want to drive 30 minutes to the closest town, but you can drive 5 minutes down the road to the pharmacy and get tested for it, then that's creating access that patients wouldn't have otherwise.
Yeah, but it's also, there's a convenience factor though. To me, even in town, I'm going to go in the clinic and I'm going to wait how long? I'm going to wait an hour.
And I may catch
something else. Let's not say that clinic. Let's say a clinic. I'm going to go in a clinic and I'm going to wait an hour or two as a walk-in, right? And then I'm going to go to the pharmacy where I could just go to the pharmacy and in 5 minutes have a test.
Yep.
And 10 minutes later walk out with Tamiflu. At some point, the market's got to say, hey, the clinic now maybe a clinic could have a triage. Wouldn't it be great if you walk in the clinic and they could say, hey, let's go ahead and swab you as a test. You don't need to see a doctor, right? We can test and treat and send you on your way.
Right. And there was a group of there was a couple of these ladies. They were in the CPSN booth at Amerisource, and that's what they do is they connect pharmacies with these virtual doctors or physician assistants that can go, cool, these are your symptoms, let the pharmacy do the flu test, and then the physician assistant or doctor can go, cool, here's a prescription for that medication. And for your more rural, and also for the states that don't have quite the ability to prescribe Tamiflu or amoxicillin like Arkansas, and I think didn't North Carolina just do something like that too? But it was for smoking cessation.
Yeah,
being
but
able to
Bentonville's not
prescribe
rural.
and get that right.
But you have to think about some of these. There's decisions have to be made. A lot of times, clinics are designed around the efficiency of the doctor. They're not designed around the efficiency of the patient, right? If you have a 10 o'clock appointment, they tell you to be there at 9 and that kind of stuff. And so there's some of those low-end things that either clinics are going to have to become more caring more about the efficiency of the patient, or that's going to go to telehealth, or it's going to go to the pharmacy. And some of that stuff pays low enough that does the doctor really want to be doing it? So it'd be interesting to see where that goes. I get it, and we hear that a lot. We hear that a lot. One of the big things that is kind of going around the country and we talk about now is subscriptions, monthly. Pay for your pharmacy like you pay for your health club. Right. And something may be in there, maybe a telehealth benefit. So, you $50 a month comes with some kind of telehealth benefit. And, hey, this class of drugs is free if you get a prescription. Your really cheap drugs. And this next class is cost plus, et cetera. But there'll be a lot of people hesitant to that because, well, I got a doctor next door. But so many people don't have doctors. How many people today in the 30 and below don't have a primary care doctor? I didn't have they made us get a primary care doctor, just saying, in the last 2 years. I didn't have a primary care doctor before. I was Dr. Internet. I went and paid for my own labs once a year, and all my labs were great, and no reason for me to go sit and wait in a doctor's office. Yep. So it'd be interesting to see. That's true.
Is that our insurance under our company, they now require us to have a primary care.
Yeah, if we don't do certain things, we have to pay an extra $50 a month.
Right.
Which is...
It's like, and it's like, it's not that hard. Go get some blood drawn.
Right.
And I'm starting to make my daughter do that. Like, you're 18, you should get your blood drawn once a year and figure out, you know, especially with the way she eats. It's like, okay, you're going to have some cholesterol issues because it's pasta, and chicken and steak once in a while is not sustainable.
Right. Yeah. That sounds about like my younger son. And yeah, I mean, getting blood work done once a year can catch things that, that you don't want to wait until you have symptoms and something may be more
Too far
advanced
gone.
or,
Yep.
worse off.
Yep.
So are y'all doing anything marketing wise in the pharmacy?
Yeah. So when our DSME program, we got the accreditation and everything, we did, kind of detail, I guess, if you will, some of the doctors that we prescribe a lot, or that prescribe a lot of medications to us. And we're, I think, going to do a billboard or something coming up here in the next few months.
Wow.
But we do, what we have learned and what we have, from our patients and from just some of the services that we offer is that our best marketing is marketing to our patients that already come in the pharmacy.
Yep.
We have been doing smoking cessation since 2018 when we got a grant from one of the other colleges of pharmacy, got a grant to do that. And so when that grant went away, we just said, we've got the momentum, we've got the process in place. We've already marketed to doctors. We're just gonna, we're gonna keep going with it.
Yeah.
And so we did. And now we're getting paid finally. I was like, well, one of these days we're going to get paid for this.
Yep.
And now
If you build it, they will
we
come.
are. Yeah.
Do you keep up with how many people have quit smoking?
So I did for a while. I've lost count a little bit, but I do have patients that come in, and I had a guy come in a couple months ago that was like, my wife and I are going on a cruise and we're doing it with the money that we would have spent on cigarettes.
Oh,
That's
nice.
awesome.
I thought that was pretty cool. That made
is
me feel
awesome.
pretty good.
Yeah.
Not just a great success story, but that's a great marketing line. It's like, quit smoking,
Yeah.
take a cruise.
Right. Yeah. I mean, that's one of the big
That
things
is a good-
about it.
Yeah, quit smoking, win a cruise. Well, how you win a cruise? Well, you're going to win a cruise by the money you're not spending on.
Put that money in a jar.
That's what you're saying.
or
Quit
something.
smoking, win a cruise. That's
Right.
it's perfect.
Yeah. You give me ideas here. But yeah, so we do a lot of just in-store marketing. Sometimes I'll overhear conversations at the register, and so then I'll walk up and be like, hey, how are you doing with your diabetes management? And that's how I've gotten patients and that have kind of self-referred to my program, and then I've reached out to their physician to get a referral for that. So so yeah, just marketing to our own patients is our best, and word of mouth.
Oh yeah, that's the best marketing.
It's huge. Way bigger than TV, or nobody watches the news anymore, I feel like. So
all right,
or commercials, because of the beginning of TiVo, and now it's just fast forward.
TiVo.
Right.
I remember
All right,
TiVo.
so I need your help.
That was the best
I got to
thing
keep
ever.
remembering. You got to keep reminding me to do this. So at NCPA this year,
Yes.
I generally introduce the second journal session. I do a little talk. This year is going to be 10 ways to run your pharmacy out of business, which is kind of doing the opposite, right? And so the one thing that I've gotten from another guest is don't communicate with your staff. So basically, you're coming up with what are the 10 most important things to keep your pharmacy in business, right? And so,
So it's kind of like that TikTok meme you watched yesterday, which is put your fingers down if you're a psycho. So put your fingers down if you're doing any of these. If not, then you're in the top 10 of doing good.
yeah, Marsha didn't have any fingers up, but. So what would be as you've 18 years in this pharmacy, what would you say is one thing that's really, really important to keep your pharmacy in business that's not communicate with your staff?
Yep.
Get to know your customers and get to know their stories.
Nice. Okay. So if you want to run your pharmacy out of business, don't get to know your customers.
Okay. So in that sense, you have Pioneer. So are you utilizing the comments section on your patients?
Oh yeah. We overutilize it to the point of comment fatigue.
Uh-oh.
So I'm filling a prescription and I just keep scrolling.
Right. It's like, we have all sorts of things. This person, their first name is this, but they actually go by this.
Right.
Or this person is always a delivery, no matter what. If we get a medication called in, if it's their
Actually, that's an interesting field to add in.
Always deliver.
What's their legal name? What do they prefer to be called? I mean,
There
you
is
see it on,
a feature on Pioneer, that has that preferred on
There we
there
go.
now.
Yeah,
so
that's
you
new.
can actually put
That's
their
new.
preferred name.
It's like, I don't
Right.
remember
And
that being there,
we've
but
just
that'd be
discovered that and started using it.
Yeah.
So
Yeah.
Nice.
Mine would be like Jeff Key, God of Thunder. Right now.
it'd be Jeff Papa. I don't know. There's some days I call you Jeff Papa, like from Jeff Dunham.
You're using
Or
an unnecessary F.
You're using an unnecessary F. Jeff Papa. Or I call him Joffrey, depending.
All right, so I like this. So don't get to know your customers. All right, so give me some ideas. So in getting to know your customers,
Okay.
how do I do that? How do I make sure I get to know my customers and their stories?
You talk to them. You put that face with the name and sort of getting to know something about them, or knowing who their family members are, what they do for a living.
Yeah.
And
It's
then
creating that
you start
stickiness.
to make those associations, and kind of know. And so you can, when they walk in, be like, so how's your brother doing, or how's or something about their medical history. How are you doing with your diabetes management? And so just getting to know them, getting to know what their struggles are. And
Well, and that's that little bit of effort in what you said the best marketing is, which is word of mouth. And you're creating that stickiness with that patient, that they go around and they tell their friends, this pharmacy actually cares about me. They know my story. They remember my dog. They remember my brother recently went through something and I was going to visit him or help something. So it's creating that stickiness and creating that word of mouth, that relationship that gets you that word of mouth, that best marketing.
I'll tell everybody something super fun to do that can talk about that kind of relationship with people, right?
Is it a
whenever
theme
you
song
whenever you sit down in a restaurant, the waiter comes over and what do they do? What's the first thing they do?
They introduce themselves.
They go, "Hello, my name's Jeff and I'll be waiting on you today." Right? And you go, "Oh, okay, that's nice." Right?
Oh yeah, you've started doing
Try
that. You
this.
introduce yourself.
When the waiter says, "Hey, my name's Jeff and I'll be waiting on you today," or sorry, we use a different one. We had Reagan. So, "Hey, hello, my name's Reagan and I'll be waiting on you today." "Hello, Reagan. This is I was with my daughter. This is Kaylee and my name is Jeff." By introducing yourself as well, which you do with anybody else in the world,
their demeanor changes.
The whole deal changes. You just change the relationship. You see almost instantly this paradigm shift in how they react to you. They smile.
Well, not just
they're more
that.
likely to tell you a story about themselves, or they'll talk to you more. It's a totally different experience, and you can see it the instant that you do
because
that.
you cared about actually having a little more of a connection rather than just this is what I want to eat and drink and thank you, go away.
Yeah.
And I've noticed the same thing also.
Everybody should try that.
Yeah, in any
Leave
type
comments.
of
Tell
service
us how it worked
industry
out.
where they wear a name badge, if you take the actual second to not just say thank you and walk away, but go like, "Hey, thank you, Julie," and you actually see their face change and light up that you cared enough to read their name and call them out. And
it helps you remember it when you need them. Because by introducing yourself, you help remember their name, so that when they're across the restaurant, you need them, you're like, "Hey, you." So it's cool.
Yeah.
This is something everybody should try. It's my story for the day.
Yeah. And we had a guy who came in, and there was a several month window of time when a unnamed chain pharmacy was going through some really and they probably still are, staffing struggles, and I mean anyway, we had a patient come in and he's like, he walked in the store and he said, "Do you answer the phone when people call?" And we said, "Yeah, we answer the phone." And he said, I'm that's all I need to know.
That's what I needed.
I'm transferring my prescriptions here.
Yeah.
And so, and I know a lot of stores, even plenty of independent stores have the IVR systems and whatnot. We've always chosen not to do that, even through COVID, which bless it was. We had all 5 lines ringing all day, every day for months.
It's super interesting. That was one of those things at Pioneer. We've never had on the Pioneer side, we never had an IVR. The Dixons, who are original owners, didn't believe in it. They believed a person answering the phone. We went through a lot of consternations to not have an IVR.
Right.
Which is why we eventually added the button where you could just say, "Hey, call me back."
Yeah.
So you weren't going through a call tree.
Yep.
Yeah.
So that was today. Do y'all use any of your patients message you? They text you or Or
Yeah, they do text us through Pioneer. So yeah, we have the automatic or the text notification
Yep.
where when we scan their bag in, they get a text, and some of them will text back immediately, thank you, or it's really
that's
funny.
why. So we quit charging for when they text you back, because we were like,
oh, that's good to know.
Yeah, we only charge for outbound text. So we just calculate it. So if they type back okay or thank you, you're not getting a charge for that. Because a lot of people were like, okay, because people feel like they
stop
need to
texting.
Right.
Text more.
Which is interesting. It's one of the things my boss does. If you get if you email him something, even if it's like information, he's always going to email back and say, well, thanks for sending that, or thank you for doing that.
This is great. Yeah. He's going to always reply back something like, cool, thanks. I like it, just acknowledging that he accepted, he read the email, he got it.
And to me, I think about doing that myself, and I think about, I'm just generating traffic for people. Why am I just generating? But it's interesting. It does kind of make a difference. It makes you feel like, hey, I got it. And hey, I appreciated it.
He's acknowledging that he got an email from you, and it's a shift in everything.
Interesting.
No different than, hello, Jeff, thank you for waiting on us, I am Jeff and this is Marsha.
So any dreams? What's your dream? So we're working, here's where we are today. We're working on diabetes. This is where we're active. What's the dream? What's the dream up here for your pharmacy?
Well, just to continue to grow our clinical programs. I mean, I think that's the big thing. I love doing the diabetes classes, and I want that to just continue to grow, and smoking cessation. I mean, like, the story I told you, I mean, I want to have a lot of stories like that, a lot of stories of people who whose A1C went down 2 points because they went through my class. I like having those stories, and so I just any more program, we try to, anything that comes our way, in terms of opportunity, we try to take it and see if we can run with it. And so,
So Deanne Mullins was also teaching, and she had a classroom set up, and I loved how her model was that she had boxes of food. So it's like, cool, this is what you made for dinner. Now let's learn how to, it wasn't fake food. It was just kind of, let's learn how to read the packaging.
Which one of these would you choose?
Well, it was, let's learn to read the packaging and see how this is going to affect me. And she had some inspiration, which really pushed her into that. And her process was paper, and then she moved to Pioneer and got it completely. So what does your classroom setting look like? Like, she had patients actually coming into her pharmacy, and she had a classroom and got out the boxes of food, like the zebra cakes. And I was like, that's not something a diabetic should eat. But it was super interesting, like her take. And it's like, let's get your file out and let's show you how to track this and look at food and where it's going to put you. So what kind of classroom setting do you have? How many patients would you say that you come in?
So we have an actual classroom in our pharmacy, which we've used for a lot of different things. We used it. That was kind of our COVID vaccine central. And we use it for, we actually have early voting there, and some other things. But for diabetes,
interesting.
I know. For diabetes class, we have TVs up on the wall, and so we can connect. So I have PowerPoint slides for the different modules, like healthy eating and physical activity and healthy coping, all those different behaviors to to help manage your diabetes. And so, but I also try to use I've brought in some sample healthy snacks to let people try. I also have some sample nutritional labels. I've got the plastic food. I haven't really incorporated that yet. I haven't figured out a good way to do that. I had in my first class, I have a friend who teaches yoga, and she does some chair yoga for older people who can't get down on the floor and get back up. And so she came and did a chair yoga demonstration during the physical activity module. So I try to make it more interesting than just me getting up there and talking at them. I also have a whiteboard, and so I try to get the class involved, asking them questions and getting their feedback. And then involving students as well. Like I love having pharmacy students and help me present, help me. I had one that made a Jeopardy game for the final class to kind of ask them questions.
Gamifying things makes the learning more fun instead of just staring at the content. But speaking of, I mean, this sounds like a lot of really great content for social media. Do you do any kind of patient awareness social media content for your pharmacy on Facebook or anything?
We do. We could do more. That's one area where we really need to expand our marketing, because that's kind of that's where everybody
free
goes.
Marketing too. Just they look at your pharmacy and see what's going on. And if you're putting out, I mean, Phil's my pharmacist. He got more patients enrolled in his pharmacy just from TikTok.
Yeah.
Wow. And it's free.
That's
I mean,
all
you have to do is just create a video, put some content.
Do they weigh
out there?
When y'all come into class? Is it like a support group, so everybody weighs, kind of like a Weight Watchers kind of thing?
Yep, they weigh, but we keep it private. Like, we don't announce it or anything to the class. Yeah, we want it to because people are pretty protective over that number. So.
Yep.
But yeah, we do. I take a weight. I take a blood pressure. And then if they have if they took their blood sugar that morning or took it at any point during that day, or they have a CGM, then we get a blood sugar as well.
Yeah. Very cool.
So what are some, I love this. And I think that just, I know that there's a lot going on in pharmacy, and some pharmacies choose to focus on this. And I love the pharmacies that focus on diabetes, because I have a family member that found out that they were diabetic, and it was just a weird, funny conversation. I had to call it out to the doctor. So I wish more pharmacies could, hey, great, you're diabetic, so let's make a plan for you. Let's do some, more frequent checks. And I wish there was more pharmacies out there that would jump on and do that, instead of just, putting pills in the bottle and then worrying about their front end looking cute. So, which is what the pharmacy she was going to kind of seemed like they were doing. So, yeah.
Interesting.
Yeah, and I mean, I would say that I shared this, when earlier, and I got permission from my son to share. But when I was going through the accreditation process, I started noticing some things with him, and one night I said, let's just take your blood sugar and see what it is, and it was 578.
Oh my gosh.
And so yeah, we
so that's what got you into diabetes.
Well, I had already started the process, but I think that
it turns you on to something.
It really it definitely did change my way of thinking about it. It wasn't just these aren't my just patients. These are like real people that have lives, and that are this is a diagnosis that is life-changing, and it can be traumatic, and it's something that you have to think about 24/7.
Yeah.
And so that angle of it really helps me, I feel like, be more empathetic, and also, both sides of the equation. I learning about it to be accredited has helped me understand it better, so that I can help my son manage it better. And then having a son with diabetes, I think, helps me be more empathetic with my patients.
It's interesting because you just think about a person and a disease state, but you don't think about how that shifts their entire world and their way of thinking. There was a master class that I watched, and she is a Peloton cyclist instructor, and she just went off and she was doing marathons. She used to be a lawyer, and then she decided, I don't like this. I feel better. I feel wonderful about myself and what I'm doing when I'm running. And so she quit being a lawyer and moved from New York and got into that. And then she found, it was more Jenny. She found out in her journey that she was diabetic. And she said it made her just shut down and go, okay, what am I worth? What am I doing? I can't work out anymore because it's going to affect my blood sugar. And it made her just, it made her shut down. And she talked about how she pulled herself out of that mental thinking and going, this doesn't change me. It's my new superpower.
Yep.
And I cannot think of her name right now. But and I'll think about it later.
Well, and that's in the getting to know your patients.
Yeah, it's getting to
so many doctors get desensitized, or healthcare professionals.
It's more than getting to know your patients. It's thinking of them more than just a patient and a disease state. I'm going to be I'm not just going to be your coach. I'm going to be your cheerleader. Yep. This isn't at the end. This isn't this isn't the bottom of the barrel. This is your new superpower.
Yeah. Yeah, for sure.
All right. Well, I think we're coming to the end of our journey. It was nice meeting you, Julie.
Yeah, nice meeting y'all.
We'll have to pop in. I need to go to Fayetteville now. Pop in the pharmacy.
Yeah, you've got to do your farewell food tour.
Yeah, I know.
Before he leaves.
My schedule's not as flexible, but.
But well, thank you so much for joining us today, and we hope we get to see you in person in October at NCPA.
Yep. Yeah, are you going to NCPA?
I unfortunately am not going to be there. I wish I could be, but my boss, my owner, he's my cheerleader, I would say, but he's great. He's let me do a lot of different things and try a lot of different things. So he will be there, Phil Roselle. And
we'll tell him to come by the booth and say hi.
He definitely will. Yeah.
All right.
Sure.
All right. Thank you, Julie.
All right. Thank you. See you later. Bye-bye.
Thank you for watching the Catalyst Pharmacy Podcast.
If you enjoyed today's episode, please like, subscribe, and follow us wherever you get your podcast.
Give us a 5-star rating on Apple Podcasts to help us reach more pharmacy professionals like you.